Good morning, guys. I hope you guys can hear me. If Annette, if you have the possibility to just confirm that you can hear and see everything, that would be great. Yeah, thumbs up. Amazing. Welcome to this webinar. My name, for those that haven't met me yet, is Daniel Kumar. I'm the CEO of ETN, Extraction Technologies Norway. This is the company that has commercialized and made the world's first EME device. And together with me, we have Fredrik André Hansen from the University of Oslo. Do you want to give a short introduction, Fredrik?
Yeah, sure. So as mentioned, my name is Fredrik André Hansen, and I am a postdoctoral fellow at University of Oslo, where I do basic research on this technique called electromembrane extraction. So of course, I know a good deal about this, and we will continue our series of talks on the subject from previous webinars.
Amazing. I think we are more or less everyone attending already. So if you want, you can just proceed with the talk.
Yeah, sure. So today for this webinar, we will, as mentioned, continue a bit with the subject that we have covered in previous webinars, which has been electromembrane extraction with voltage. And in general, I can say that electromembrane extraction is a voltage-based technique. But the thing is, you can also do it without voltage, and then we call it liquid membrane extraction, or LME, which is illustrated down here. And this we will cover much more today, and how this is done in practice, and also what are the differences and when you might use either. Just to catch everyone up to speed that might be new, then we will first begin by introducing the basic EME principle and its advantages, and then we will cover the ETN instrument and the consumables that are used before we dive into the more fundamental section about how we drive extractions using these techniques, and also introduce the liquid membrane extraction, which is, as mentioned, without voltage. And finally, we cover when you might use EME with voltage or without voltage. And if you have any questions, then please feel free to post them in the Q&A section, and then we will address them towards the end. So to start off, let's have an introduction of the technique. Electromembrane extraction is what is called a micro-extraction sample preparation technique that is derived from the classical liquid-liquid extraction. And essentially, this is a process of electrophoresis across an oil membrane. The way it works is that we take a piece of porous polymer membrane like this, so a membrane that is not very thick, just 150 micrometers. And this, of course, has a lot of pores. And in these pores, we can apply an organic solvent that will sit by very strong capillary forces inside of here. And then we call it a supported liquid membrane, or SLM, when essentially you have a liquid membrane held inside a support. We can use this SLM to separate our sample, being this one here, from a clean acceptor solution. And this sample can, of course, be many different things, being biological or environmental, or maybe it's a pharmaceutical product. Essentially, it just has to be aqueous. We then have the acceptor solution, which is just a neat water solution. And then we make sure that we adjust the pHs of these solutions so that the target analyte is ionized. So let's say it's this guy right here. Then we apply a voltage across the liquid membrane by applying it to the containers they're held within. So if we apply a negative potential in the acceptor, we can stimulate the extraction of this positive ion across the SLM and into the acceptor solution, while anionic matrix components remain, and also neutral analytes will either remain or have some passive transport into the liquid membrane, but there is nothing driving their extraction forward. Once we're done, we can take our acceptor solution and inject this directly into HPLC or MS instruments, which is what we mainly use it along with today. But of course, you can use any different kind of analytical technique. The principle itself was invented in 2006, as it says here, and since then it has lived in the academic environment and more than 500 papers have been published. But since last year, you can also buy commercial equipment made by Extraction Technologies Norway, which is the ETN12 device that you see illustrated here. So what are the advantages of EME? For starters, it is a one-step sample preparation technique, meaning that we can go from something as complex as, for example, whole blood in the sample to a neat, clean, accepted solution that we can inject directly without having to do any additional steps like filtration or centrifugation, evaporation, or reconstitution. So it's very efficient in how it's done practically. It's also compatible with very complex samples. I mentioned whole blood, but you can also have other biological samples like serum plasma, urine, cerebrospinal fluid, or even tissue. And you can, of course, also use it for environmental samples, foods, or pharmaceuticals, which we will see an example of later. It offers selectivity based on two mechanisms, both the analyte charge, which we can see is depending on which direction you have the electric field. So if I want to extract the negative ion, I just flip it so that the positive electrode will be here. And we also have a selectivity by the hydrophobicity. So depending on what organic solvent we put in here, there are only certain ranges of hydrophobicity of analytes that are allowed to pass through. This we can control, and therefore we can quite well control what is extracted and what is not. This selectivity involves a complete discrimination of proteins and phospholipids that, especially when you have these biological samples from the body, are very troublesome when you run chromatography and LC-MS because they will either clog the column or cause serious signal suppression. Finally, the technique is non-destructive, and this is because that we can, in theory, reuse the sample afterwards if we have some other use for it. And we also use green and safe chemistry. Green by the fact that we use very little solvents inside of here, and safe by the fact that the solvent we do use is non-toxic and non-volatile. So let's quickly go through the instrument and the consumables. The commercial equipment from ETN is based on these vials that you can see are shaped in are shaped like HPLC vials, but they are a little bit different than a typical HPLC vial by the fact that the top part here is made in a polymer that is conductive. So if I add electricity to the outside here, it can conduct the electricity to the inside of the solution that is placed inside. These come in two different sizes. One is up to 200 microliters and one is up to 600, depending on what the requirement of your analysis is. And when we work, we pipette a volume that is not quite full, but typically it will be between 200 and 500 microliters or 30 to 150 for these two sizes. When we operate, then these are screwed into a leak-tight interface, so they are brought together, and we have this polypropylene membrane that sits inside of this and is used to house the solvent that is making up the barrier. And of course, if you want to do some pre-concentration, then you can use a large vial for the sample and a smaller vial for the acceptor solution. So, for example, you might be able to get up to 10-fold pre-concentration. Preparing an extraction is quite easy. The first thing you have to do is place this membrane into the union, which is done by a pipette tip. So once that is pressed in, then we load our acceptor solution up into the acceptor vial, and we screw the union with the membrane so that the acceptor vial fastens the membrane in place and tighten it firmly. Then we pipette a small volume that is around 6 to 10 microliters of organic solvent onto the membrane surface like you see here. And then that goes into the pores of the membrane and becomes immobilized. This typically takes half a minute to 1 minute, and you can quite clearly see when it's done successfully because the membrane turns from white to transparent or sometimes slightly opaque, depending on what solvent that you use. Then you fill the sample and screw that into the other side of the union. You can put a mark on the plastic part here to identify the vials. And then we place this unit into the holder of the instrument, which has space for 12 parallel cells. We apply a lid that has one printed electrode that comes into contact with each vial, so that we can have 12 parallel electric circuits. So close the lids and apply some shaking and apply some voltage to stimulate the extraction. This is controlled from a software that is connected to the instruments, where you can have the 12 positions and enter a sample ID. You can enter the specific voltage that is used to drive the extraction for each channel. You can enter what agitation rate and extraction time that you need. So after the extraction, the voltage and agitation is automatically switched off by the instruments. Then you take out the cells and disassemble them, and you can screw an HPLC cap directly onto the acceptor vial and put this into the autosampler for a fast and easy transfer. Or if you, for some reason, would like to use something else, like a 96 well plate for the HPLC, then you can transfer it by pipetting. Okay. So now we have covered the basics of the technique and how you do it in practice. Now we will go a bit more into the fundamentals of the extraction principle. To do that, we will start off by a simple system that we see here. We have our aqueous sample, and we have our liquid membrane, which is an organic phase, and we have the acceptor solution, which also is aqueous. Just to make it easier to see, then this liquid membrane here is quite big, but remember that in practice it is only 150 micrometers thick, so really quite thin. If I take a drug substance, this is called atomoxetine, which is an antipsychotic drug, and place into this aqueous solution, then that will have a positive charge on this amine, because that the pH of water is smaller than the pKa of this amine. If we then study how this can be transferred from here to the liquid membrane and to the acceptor solution, then that involves two steps. The first step is the transport into the liquid membrane, and this is characterized by an equilibrium. So some of it will go in here and some of it will not. And this equilibrium we call T1, which is transfer from the sample to the liquid membrane. Once it's in here, then it will also tend to go out to the other side just by passive diffusion. And this equilibrium we then call T2. But what drives this equilibrium to even happen, or determine if it's mainly shifted towards the sample or towards the liquid membrane or towards the acceptor? For that, we have to look into the solvation of substances. And we will just have a slight bit of thermodynamics, but I promise it will not be too much. Because that the reason why things are solubilized in a solution, being water or an organic solvent, is because that the solvent interacts with the molecule by specific interactions. So for example, we see here that we have a positive charged amine, which can interact with the oxygen in water, and we have a ether group here that can form hydrogen bonding also with water. So this is solubilized in water, and that has a specific amount of energy, which is what we have here, the Gibbs-free energy of solvation. The same can be said inside of the liquid membrane, but of course that's energy can be different. So to determine if this substance will transfer into the liquid membrane, we have to see which of the two energies are the biggest. So we can see that if it's more favorable to have bonding of the analyte inside of the liquid membrane, well, then it will partition in here, because as you might remember, Gibbs-free energies, when they are negative, then that means that the reactions are spontaneous. So if we just skip the equation, then we can put it another way and say that the transfer into the liquid membrane is high when the solvation that you get inside is greater than outside. So that is one key factor. How can this, or how will this change with the properties of the analytes? Well, if we increase the number of polar groups of the analyte, for example, I might add a secondary amine here, then the solvation of the analyte will also become stronger in the sample, which means that it's less favorable for it to go inside of the liquid membrane, and therefore T1 will decrease. For T2, which is the transfer from the liquid membrane to the acceptor solution, the opposite is true. So the same applies, that it will distribute into the compartment where the solvation is most favorable. But now we see that if I add a polar group to the analyte here, then it will have, if I were to take away a polar group from the analyte here, it will have poor solvation in the acceptor, and therefore T2 would go down, and it will tend to be trapped inside of the liquid membrane. If we expand the number of substances from 1 to 90 and extract these and measure how much was transferred from here to here and express this as the recovery, then we can plot this recovery as function of the analyte hydrophobicity, which we express by the log p value. So greater log p value means greater hydrophobicity. And we see here that we have 3 zones, where you have one zone here in the middle, where most substances that are present here are extracted with high efficiency when we apply a voltage. And this is because that both the T1, so transfer into the liquid membrane, and T2, transfer out of the liquid membrane, are great. When we go to the more hydrophilic region, then we will see that the transfer into the liquid membrane becomes very slow, because it's much more favorable for this guy to be outside, solubilized in the aqueous environment. But once it gets in, it can be quite efficiently transported to the acceptor solution, because it's also more favorable to be here. On the other side, we have substances that are very hydrophobic, so they will go quickly into the liquid membrane, but they do not come out again because they are efficiently solubilized in here. So this extraction window, of course, is something that we can move and manipulate depending on what solvent and what other parameters that we design the method to have. For this, I will refer you to look up the previous webinars that we've had, where we have discussed this in greater detail. I have some links towards the end. So no doubt about it that we need high T1 and high T2 values. So how can we make sure that these are in fact both high? Well, one option is to use voltage to assist the partitioning of this into here and onwards. And this is what we do when we have electromembrane extraction. If I now adjust the pHs of these solutions to be low, so that this one will be very efficiently ionized, then I will connect this system to a power supply. But initially, I will wait on turning on any voltage. So now we just set the voltage to 0, meaning there is no driving force. If we look at the solvation, then since both are positively charged, then both will be well solvated in the aqueous environments, which means that it's not very favorable for the compound to go into the liquid membrane at this condition, so the equilibrium will be shifted towards the sample. However, a small part will go in, and since it's also well solubilized in the acceptor compartment, then whatever goes in will likely also come out again. And this means that the extraction here will progress. It's just very, very slow. So how can we accelerate it? Well, we can add a voltage. So I turn that up to 50 volts now. And this will drag this towards the negative terminal, meaning that I shift the equilibrium to be more inside of the liquid membrane. And once it's inside, then the voltage will also help drive it out again, but that was already favorable, as we saw before. So that is the basic principle of electromembrane extraction, that we use a voltage to modify partitioning coefficients to drive the extraction towards our acceptor. Yeah, so the voltage in this case mainly helps to increase the value of T1 to get the good recovery. If I do something else, just to see what happens, if I change the pH of the acceptor to something that is above the pKa of this, then we see it loses its ionization. And because that means we have less interaction with the water molecules, then this molecule will be less well solvated in the acceptor solution, meaning that even though T1 is great, then the value of T2 will be shifted towards the liquid membrane, and this will then cause all of the substance to accumulate inside the liquid membrane, because that this now has no is not influenced by the electric field since it has no charge. So this means that you can, in theory, drive substances from an aqueous solution into the liquid membrane just using passive diffusion. And this is then the principle of liquid membrane extraction, so driving the extraction without voltage. So now I do what I just did before, just in the opposite direction. I make sure that the pH of the sample is high. Under this condition, then this will be neutral, and the pH of the acceptor is adjusted to be low. Then this is ionized and therefore well solvated, and of here it's not so well solvated. So this means that it's favorable for this guy to go into the liquid membrane, and once it comes in and reaches the interface here where it's protonated, then it's also very favorable to come out again. So I can drive the extraction simply using a pH gradient. One thing to note here is that now the distributions are based on passive diffusion. So as long as both are high, then it will be a good recovery, but the process is a bit slower compared to when we have an active driving force like the electric fields. Since this distribution is related to the pH by the fact that pH controls the charge, then we can just take a look at how this is related. The distribution between the aqueous phases and the liquid membrane can be described by D, and D is defined as the concentration of neutral analytes that is going into the SLM at equilibrium divided by the concentration of analytes, both neutral and charged, that is outside. Since the analyte can be neutral or ionized depending on the pH, then we have to relate this to the degree of ionization, which can be expressed by this equation. And if we combine these two and plot the results, then we can plot the log D of the compound as a function of pH. And we see here that when we are at the lower end of the pH range, then of course we have the positively charged version that has a lower log D value because it distributes less into the liquid membrane. And on the opposite side, where it's neutral, then we have a higher log D value. Since this is logarithmic, then it's difficult to really grasp how big a difference it is. But if we calculate the actual difference, then there is about 1,700-fold difference in hydrophobicity between this version and this version. So you see that it's very important that the substance is kept at its form to get a good partition into the liquid membrane, and then it's also very important to get it on a protonated form to go out of the liquid membrane again. So essentially we can say that in liquid membrane extraction, the extraction is driven by the difference in analyte log D value between the sample and acceptor solution. So as long as this difference is great enough, and as long as the T1 value is also high, then we will have a good recovery in the acceptor solution. But this, of course, assumes that you can ionize either positively or negatively the analyte, and that is not always the case. For example, we have this compound called NDPA for short, which is what is called a nitrosamine, which I will go a bit more into detail with soon. But this has no basicity, so we cannot use pH to influence how this distributes. But if we place this in the sample, that is just water, no pH adjustments, and see what happens, then this is a fairly hydrophobic molecule, so that will have some partitioning into the liquid membrane. But since there is nothing driving it out, then it will generally remain inside of the liquid membrane if we use water, because the T2 value is small. So how can we increase the T2 value when there is no ability to use the pH? Well, we can use a solvent gradient. So if I, instead of having water here, replace that with a mixture of water and DMSO, then the interactions that can be formed between the analyte and the solvent here are much stronger than when it was just water, meaning that we still have a favorable transfer into the liquid membrane, but now it's better solubilized outside in the acceptor, meaning that T2 value is driven towards the acceptor despite not having any charge. In this case, the recovery with this method was 96%. So you can see that it can be just as efficient as when we use a voltage to drive the extraction. So now I will show you an example of how the performance of these two strategies can work, both with the pH gradient and also with a solvent gradient to drive the extraction of phenols and bisphenols. Bisphenols, as you may know, are endocrine disruptive compounds that have this general structure, then they can vary a bit in what else is on there. But they have two phenol groups. And this means that since these are weak acids, then we can make these negatively charged if we raise the pH high enough. So one way to extract these by pH gradient is to place them in the sample. In this case, the sample was a human plasma sample that was mixed with some buffer to lower the pH a bit to make sure that they really are in their neutral state. We used a supporter liquid membrane called dodecanitrile. Not so important exactly why this was used right now. But the acceptor phase was then a dilute concentration of sodium hydroxide with pH 13. So at that pH, both of these were negatively ionized. If we compare to the solvent gradient system, then we had the same sample. We also had the same liquid membrane, but now instead of using strongly basic conditions in the acceptor phase, we used a 90% DMSO solution. And if we then go on to compare the recoveries we could get, then here you see the different substances that were used. We have regular phenols like phenol and these two here that are substituted phenols, and then we have different bisphenols illustrated here. And these cover a quite wide range of hydrophobicity, so bisphenol M is very hydrophobic, and up in the other end they are quite hydrophilic. So with the pH gradient, we got nearly 100% recovery for all except bisphenol S and bisphenol M. While we with the solvent gradient had very similar selectivity, but the extraction of bisphenol S was about twice that. So you can see that depending on what solvent system you used, you can get nearly the same efficiency. Reasons why you might want to use the solvent system could, for example, be if your analytes are chemically unstable at this basic pH, or if you imagine that we extract the other way and have a base as the analyte, then we might have to get very acidic conditions, which could cause some degradation. All right, now we will show a bit of an example of when you can use either EME or LME and when they are advantageous. If we just do a point-by-point comparison, then we can initially see that the extraction equipment and the preparation of an extraction is exactly the same, so that is not any different. The requirements for analyte ionization are a bit stronger for EME since analytes must be charged, whereas LME you can have analytes that are neutral or have the ability to become charged. The most important parameters in EME are the liquid membrane, because that controls a large part of the selectivity, and we also have the same for LME. But then they differ by the fact that EME mainly use voltage as the driving force, whereas LME we use the sample acceptor composition, which is the pHs, and also the presence of organic solvent like DMSO to drive the extraction. And then similarly, both have time as a very important parameter since the extraction typically will become more efficient with more time. Solvents used in EME we have covered in some of the previous webinars, but I can mention that we have developed a number of generic solvents that are used for specific analyte properties. And with LME, we have also a range of solvents that have slightly different properties than those for EME, but we don't have time to go into the details of that today. In terms of what analyte hydrophobicity can be extracted, then EME offers a bit of a wider range because that it uses an active driving force, meaning especially for polar substances that EME is more suitable to extract polar substances. And it also is easier to tune the selectivity because we can use voltage to tune that. Theoretically, EME is more complicated to understand than LME. So if you're looking for something that is not too complicated, then LME might actually be an advantage. Lastly, we can mention that extraction kinetics are faster with EME because we have the active driving force, but the matrix cleanup you get is quite similar with high extraction selectivity. EME might be more easy to tune the selectivity, again, because you have a voltage that can be used. So EME is often preferred, but when are the cases then when LME might be preferred? Well, as mentioned, reason number one could be if you are just looking for a simple extraction concept where limited throughput is good enough. Limited because that the extraction progresses a bit slower. So if you use LME, you can ignore the voltage, the current profiles that are recorded by the device, which we also have covered in previous webinars, and you can ignore other kinds of parameters that you otherwise have to think about when you do method development. A second reason is that LME is, at least in some cases, more suitable when analytes are weakly basic, acidic, or neutral. One example I will show you is the case of nitrosamines extracted from pharmaceutical tablet formulations. Just as a quick background to these, a few years ago, it was discovered that some pharmaceutical products had some impurities in them that were in the nitrosamine class. And these are characterized by having this functional group, and then what is attached can vary. The problem with these is that they are carcinogenic, and they are a byproduct of the synthesis. So, for example, it was found that metformin tablets and candesartan tablets had these present in low levels. Chemically speaking, they are characterized by being weak bases, or the ones you see here. But if they are attached to a functional group that draws electrons, then you can also have that they have no basic properties at all. And initially, we tried to extract these with EME, but had limited success, likely because of the charge we can get on these is simply not stable enough to be sustained across the liquid membrane. So we went on to trying LME instead, using passive transport to drive the extraction. So the way we did this was to cross the metformin tablet and dissolve it in a buffer at pH 7.5 in this ratio that you see here. And this is then something we're still continuing to develop. And so we have a few methods we have explored. In one method, we can extract the more hydrophobic range of these substances I showed you before. And in the other method, we have a better selectivity towards the hydrophilic region. But you can see in both cases, we use DMSO and water, either with some extra acid or without, to drive the extraction. Another good reason why you might use LME is if the selectivity that you need to get cannot be achieved with EME. And for this, we can also look at the nitrosamines, because the reason why we need to do extraction of these from some pharmaceutical tablets is that the dose of metformin is really high, like 500 milligrams per tablet. So if you simply were to dissolve a tablet and inject that directly, then you would very seriously foul your system with metformin, and you would likely never be able to get it out again. In addition, metformin can also, because it's so abundant, cause some suppression of signals of the rest of these, even if you have a separation. So if we were to extract these by EME, then we would have to lower the pH very substantially to get these on their ionized form. And we see that this metformin also have two basic groups, so that would also be positively charged, meaning that it would be very difficult to not co-extract metformin when we do it by EME. But when we try LME conditions, then at the sample pH we have at 7.5, then all of these will be neutral, but metformin is still ionized, meaning that that has very low affinity to go into the liquid membrane because it's well solubilized in the sample, whereas the rest of them can go in. So in that way, we get selectivity of the system. One additional example where there is very small differences between the nitrosamine and the parent drug is what is called a non-drug substance-related impurity, which is also a byproduct that can arise during the synthesis. So we have this mirabegol, which when it's synthesized can have a small fraction that is formed as this nitrosamine, which we need to determine. So if we just compare these, then we can see it's exactly the same molecule, so they will behave very similarly. But because this nitrosamine has a lower pKa, then we can also extract that selectively away from this. So here is the procedure that we have used. In general, one tablet is dissolved in some methanol, and then that is diluted with some buffer and used as a sample. And then we use an acceptor composed of DMSO and also some formic acid, because then we get a plus charge on this, whereas at pH 7.5, this one will still have a charge and this one does not. And in this case, we got about 70% recovery of the nitrosamine, whereas we only had a small signal for the original API. So we can get quite selective extractions, even when the molecules are very, very similar. Then we have reached the end of this webinar, but I will first give a quick summary of how these techniques differ and when you might use either. EME is generally the preferred technique when throughput is important because it extracts faster. It's also preferred when analytes are either basic or acidic, and if they are polar and or cover a wide range of hydrophobicity, then EME is a bit wider in its selectivity. It's also preferred if analytes are zwitterionic, meaning that even when the net charge is 0, then they have some positive or negative ionization, because then it's then it would be a very narrow pH range where you can actually get it neutral in order to be able to use it with LME. Finally, EME might be preferred if the basic or acidic condition that you need to neutralize the substance for LME causes degradation. Then you might be able to use the opposite end of the pH scale with EME. Finally, LME is preferred when you can get good enough results with this technique. Then there's not really any reason to complicate things. But it can also be when you have the weak bases, acids, or neutral substances that we saw before, or that you cannot get acceptable selectivity with EME. And similarly, if you need very acidic conditions to extract with EME, but that means that substances degrade, then you might operate at some more neutral or basic conditions with LME that can keep them stable. Just a few links then to where you can learn more. You can go to etneme.com to learn more about both techniques. Howtoeme.com is a tool where you can search a substance by its name or other identifier to get an idea of whether the technique is suitable and get some recommended conditions. It currently only is designed to work for EME, but maybe it will also come with LME recommendations at a later point. Otherwise, we have some links here to different videos and previous webinars that you can check out to learn more about the principle, its advantages, applications, and method developments. So with that, I think we can open the Q&A session.
Thank you so much, Frederick. We already got a couple of questions, so you can maybe go into the teams and...
Yeah, I'm navigating my way.
Great.
I'm not sure if everyone can see the questions. I will just read it. The question is to target specific analytes for extraction, only sample and acceptor solutions pH and membrane voltage are modified to adjust T1 and T2. Do you provide some kind of user-friendly calculator to determine favorable parameters, pH, voltage, etc., considering the analytes of interest? That is a very good question. And currently, this homepage, howtoeme.com, will suggest you some starting conditions to try that. But we are also developing a separate tool, and that is still in development, so it's not live yet, where you can load a substance in, and then that will calculate the optimal combination of parameters for that particular substance. So that's much more tailored than what this current Howtoeme app currently gives you. So hopefully that will be out in not too long.
Yeah, I can just mention also that the howtoeme.com is based on some generic methods that we have developed, and you can also read more about those different generic methods on our websites. And we will, I will send you a link to all of those documents as well as the presentation itself later today.
Then we have the second question, which is how specific the extraction is. Is it only suitable to distinguish polars from non-polars? And no, you can make it really specific if you especially lower the applied voltage. So we have this data set I showed previously with 90 different bases. Then if you adjust the conditions right, then you might be able to extract only 1 or 2 from this whole set selectively. But then you have to do some optimization to learn that. Nice. Okay, thank you for the answers. Yeah.
Is there any more questions? I see we have 1 more minute. And if not, feel free to send us emails with questions or anything, and we will do our best to help you guys if you're interested in the technology, or if you have some challenging analytes, please send us information and we can see how we can help you in the best way possible. Great. Thank you so much, Frederick, and thank you guys for listening in. I hope to see you on another webinar or a physical seminar soon. Someone clapping also, that's great.
Bye bye.
Okay, bye.